In this study, we will look at sensorineural hearing loss. The content will cover definition, regions settled, causes, diseases with high prevalence, typical audiogram findings, typical speech audiometry findings, possible treatment, and what can be done to improve hearing. In sensorineural hearing loss, there is damage to the cochlea or the auditory nerve from the cochlea to the brain. The sensory cells, the hair cells, are damaged or underdeveloped from birth. It is usually permanent. In sensorineural hearing loss, the damage is to the hair cells in the cochlea, the pathways to the auditory center or the auditory center. The causes include lesions in the hairy cells of the inner ear, pathologies in the stria vascularis, inner ear metabolic disorders, volume balance disorders between the inner ear fluids. Sensorineural hearing loss is caused by lesions in a large area from the cochlea to the auditory center. It can be mild, moderate, severe, or profound. While hearing aids or middle ear implants can be solutions to improve existing hearing in mild, moderate, and severe sensorineural hearing loss, cochlear implants are recommended for severe and profound hearing loss. In sensorineural type losses, sound reaches the inner ear but cannot be transmitted to the brain. The brain cannot interpret the information. In sensorineural hearing loss, the sensory cells, the hair cells, are damaged or underdeveloped from birth. The loss is usually permanent. It can progress from mild to very severe. Factors that cause sensorineural hearing loss can be grouped in three ways according to their localization. These are cochlear lesions, retrocochlear lesions, and central lesions. The causes of sensorineural hearing loss are hereditary diseases, congenital malformations, labyrinthitis, otitis media, viral infections, mumps, herpes zoster, bacterial infections, meningitis, syphilis, Meniere's disease, presbycusis, ototoxicity, sudden hearing loss, traumas, temporal bone trauma, noise-induced hearing loss, pathological conditions such as perilymph fistula, iatrogenic causes, endocrine and metabolic diseases, autoimmune hearing loss, systemic immune diseases, vasculitis, vascular diseases, cochlear otosclerosis, infections, prematurity, birth trauma, anoxia, erythroblastosis fetalis, multiple sclerosis, acoustic neurinoma. Causes with a high prevalence of sensorineural hearing loss include acoustic trauma, sudden pressure changes, ototoxicity, presbycusis, Meniere's disease, and sudden hearing loss. Diseases with a high prevalence of neural hearing loss include acoustic neuroma and auditory neuropathy. When considering the typical audiogram finding of sensorineural hearing loss, bone conduction thresholds are below 20 decibels. Airway thresholds are below 20 decibels. There is no air-bone gap. Airway and bone pathway thresholds overlap. In parallel with these findings, when the audiogram given as an example is analyzed, many theories have been put forward regarding the normal hearing limit. While up to 16 decibels is accepted as the normal hearing limit, there are institutions that accept up to 26 decibels as the normal hearing limit. On average, 20 decibels can be accepted. In sensorial type losses, air and bone conduction thresholds should be below 20 decibels. Typical speech audiometry findings in sensorineural hearing loss are that phonemes at speech frequency are not properly perceived. There is a marked decrease in discrimination scores according to the degree of hearing loss. As the degree of hearing loss increases, speech intelligibility decreases. In sensorineural hearing loss, the high-frequency region is affected first. Increasing the degree of hearing loss also affects the low-frequency regions. Silent phoneme intelligibility is more markedly affected. Solutions to improve and protect existing hearing abilities in sensorineural hearing loss include hearing aids, cochlear implants, medication, avoiding noisy environments, using ear protectors and plugs, and surgical interventions. Stay tuned for more useful content.